Hi, this is Dr. Karen Harum, Neurodevelopmental Pediatrician with Vibrant Children, and we're here today to talk about prescription medications for ADHD, some of the pitfalls, and some of the secrets that your doctor maybe won't tell you. Welcome to Vibrant Children. We've talked in the past about the increases in ADHD prevalence, increasing by 5% each year. And upwards of 15% of children in North Carolina are said to have ADHD. So along with that, we're seeing more prescriptions, more side effects of these medications, and also greater illicit use of these substances on the streets. Actually, use among mothers and even physicians is increasing. So even though I prescribe these medications every day for children, I do see them as a Band-Aid approach to the treatment of ADHD. And I know that you as parents have very difficult decisions to make with or without medication help, and I'd like to guide you in that decision-making process for your child. As you know, all medications do have side effects, but let's look at some of those specifically associated with ADHD medications, otherwise known as the psychostimulants, because I really want you to feel comfortable with your decisions to medicate whenever necessary. Well, some of the side effects include something as unusual as hallucinations, occipital hallucinations that can be described as visual snow. These individuals actually see what appears to be snowflakes, and it is determined to be a side effect of the medications like Adderall. I have also seen other types of psychosis build to develop in kids. I've seen lots of crying jags and other mood changes associated with them. I think that anytime a child looks zombied or rather boxed in by these medications, it's always an indication that the medication dose is too high. Adderall is actually a really powerful combination of 4 different amphetamines. It's often in a time-released form, and they're very effective, this class of medication for ADHD. They work to increase dopamine and norepinephrine, and that's not unlike cocaine or even crystal meth. This medication does have street value, and some college students will actually feign having ADHD symptoms so that they can be prescribed this medication to enhance their cognitive performance. On college campuses, it's referred to as college crack or even cognitive steroid. Yes, some people are crushing these medications and actually snorting them and reporting that it's a high not quite as strong as that from cocaine. Well, general pediatricians tend to write for Adderall first, probably because of the pharmaceutical marketing efforts, but this is one of my last choices due to the greater severity of side effects associated with Adderall in my hands in my clinical practice. What about Ritalin or methylphenidate? It has over 60 years of use and lots of good safety data with a pretty good record, but we now recommend a screening electrocardiogram or EKG for children who are started on these medications just to make sure they don't have any predisposing rhythm disturbances. Particularly if there's a family history, you'll want to ask for an electrocardiogram. Atomoxetine or Strattera was the first non-stimulant medication approved by the FDA for ADHD, and I like this medication if I dose it at a slightly higher than recommended dose, and I split the dose in 2, both morning and night. That seems to reduce the side effects of sleepiness that some children get, and also acid reflux in other children's. Remember that this medication has to be swallowed whole, so it's really not suitable for younger children who can't swallow large tablets or capsules. This medication also has less addicting potential and less street value, so I do like to use this medication as much as possible. However, my first-line medications for ADHD are actually the non-stimulant medications like Intuniv, Cafe, clonidine, and guanfacine. Log in to the upcoming free webinar to hear more about these prescription medications. In the meantime, I have just a couple of do's and don'ts for using these medications. Do begin a new medication on your watch, preferably the weekend, so you can really see the effects firsthand. Do start with low doses and anticipate an increase once tolerance is established and once you know there are going to be no untoward side effects. Do not expect anxiety to improve with psychostimulants. In fact, it's probably going to worsen. Don't expect nail biting to get better. That's also going to worsen. And don't expect it to be a cure-all, because behavior management support is still equivalent to pharmaceutical treatment in clinical studies. Of course, those studies didn't include the nutraceutical and nutritional supports that I'm recommending, but don't expect the medications to be a cure-all. Don't expect growth problems to be an insurmountable problem either. Really, if the kids are given a high-protein drink at lunch, when they have a poor appetite, and if they're given homemade high-protein smoothies for an after-school snack, they can usually circumvent the problems with weight gain and growth. Also, don't give a high-sugar, high-protein drink like Pediasure or Carnation Instant Breakfast unless convenience really is taking top priority. I do recommend instead the homemade high-protein smoothies. And do ask your doctor for a screening EKG. A cardiology consultation is usually not necessary. Well, I hope that you found this information helpful as you and your family navigate through these tough decisions around medications for your child. It's never easy, and you do deserve to have all of your questions answered. Thanks for tuning into Vibrant Children, and register for our free live webinar to learn more about how you can heal your child's ailing ADHD brain while it's still growing. And until next time, goodbye.